Herniated disc causes and treatment. What is meant by herniated disc? It is the protrusion of the cartilaginous discs located between the vertebrae that make up the spine, which is responsible for reducing the friction forces arising between the vertebrae, facilitating the smooth movement of the spine in general. These prominent cartilaginous discs put pressure on the nerve roots that branch off from the spinal cord, which leads to neuromuscular symptoms. What are the causes of herniated disc? Carrying heavy objects the wrong way, weakness of the neck or back muscles, whether due to genetic or acquired factors, advancing age, obesity. What are the types of herniated disc? The herniated disc is divided according to the location of its occurrence into the following types. Cervical herniated disc. It is the second most common type of herniated disc, where the protruding disc, one or more, between the cervical vertebrae. Thoracic herniated disc. It is the least common type of herniated disc, where the disease lies in the discs between the thoracic vertebrae. Lumbar herniated disc. It is the most common and widespread type of herniated disc, and the protrusion is in the discs located between the lumbar vertebrae. What are the symptoms of slipped disc? The clinical picture associated with a herniated disc differs according to the location of the injury, as follows. In the case of a herniated disc, sharp unilateral or bilateral pain in the neck, radiating to the shoulder. Stiffness of the neck muscles and limited movement as a result of the emerging pain. It is also noted that the pain is more severe when bending the neck or making a sudden movement such as sneezing or coughing. In the case of a herniated disc, chest pain that radiates through the ribs, which may reach the back. Feeling of not being able to breathe properly, as a result of the chest muscles being affected and feeling pain. Also, the pain is more severe when sneezing or coughing. In the case of a lumbar disc herniation, pain in the lower part of the back, which may extend to one or both legs in what is known as sciatica, which is accompanied by numbness and tingling, inability to stand for long periods of time or walk long distances. In advanced cases of lumbar disc herniation, the patient may suffer from urinary incontinence, involuntary urination, as a result of a defect in the nervous mechanism responsible for urination. How is a herniated disc diagnosed? Examination of the patient's medical history, and the search for risk factors such as obesity, smoking, etc. Examination of the area affected by pain, examination of the nerve response and muscle strength at the site of damage, diagnostic X-rays, including X-rays, CT scans, and magnetic resonance imaging. What is the treatment of herniated disc? Most cases of a herniated disc are treated with a conservative approach that includes rest, weight reduction, anti-inflammatory and analgesic medications, and physical therapy exercises. But in the event that the above fails to reduce the pathological symptoms associated with the herniated disc, the surgical option is resorted to, which includes the total or partial excision of the herniated disc, with the fusion of the vertebrae.